The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. The purpose of Helping Seniors is to educate, inform, and connect. We want to connect, inform, and educate seniors and those that care for seniors. And we are finding out a lot needs to be done in this area, folks, and not contrary to what you might believe and what you read and what you see and what you hear. There's a heck of a lot more to be done, and I'll clue you in a little bit on what's happening on today's show with Dr. Sheldon. But the phone number here at the radio station, if you have a question for Dr. Sheldon or myself, it's 631-1300, 631-1300. And, I've been giving some other phone numbers out, but I'm going to stop giving some of these numbers out because I want you to call Kay at the office at 473-7770. And the reason I want you to do that is because by talking to Kay, she often finds out that the problem you think you have is not really the problem at all, and there's something else that you need help with. And we're able to get you, most of the time, pointed in the right direction. So there's an element of trust both from you and from us. We have to know that you need help. You have to believe that we're sincere in trying to get that help to you. And believe me, you're not going to find anybody that's going to try any harder than Kay Kaiser. And that's Kay Kaiser, the woman, not Kay Kaiser, the bandmaster. So if you have a problem, you have a question, you just want to talk to somebody that most possibly and most likely knows a little bit more about the topic than you do, call Kay at 473-7770. The sponsors for this part of the show include Gentiva Home Health Care, the Eye Institute, Solid Bite Dental Implant, and that's Dr. Sheldon's business, and he's on my panel today. Bill Johnson, elder law attorney, radio station WMEL, Wistoff Hospital, Levin Home Care, Ren Care Medical Alert. And folks, if you're still being stubborn about using a cane or a rollator, don't be stubborn about wearing a medical alert system if you live alone or if you're frail and you live with somebody. Think about investing $29 a month to protect yourself and make yourself have a little peace of mind. Two more sponsors. Ebony News Today, they're our newest media sponsor, and the Social Club. It's a no-adult daycare down at 5200 Babcock Street, down on the intersection of Malabar Road and Palm Bay Road. So that's enough commercialism, Dr. Sheldon.
It's a lot more sponsors than I remember, Joe. This is fantastic.
That's just the first part of the show.
Oh, good.
So we got twice that many for the second part of the show.
Holy mackerel, what I have missed.
Yeah. Well, before I even get into what I was going to talk to Dr. Sheldon, let's just talk about the comment you made, Lee. You made a comment that's a lot more than you ever remembered. Folks, Dr. Sheldon was the first person I called when I said I wanted to set up a Helping Seniors nonprofit 4.5 years ago, almost 5. And I asked him if he'd be on the board. He said yes. And he helped me start this thing. He has a financial giving program himself through his business, and he contributed to our program, became a sponsor, and he got a lot of people that he believes help people to help us. So, Lee, in thinking about starting Helping Seniors in your business as a doctor, trying to make people understand more about the field of periodontal care, how about just giving our listening audience a few words on what you think of the importance of helping seniors, how it's advanced in the 4.5 plus years, and what you think we might be able to do in the future about driving down the cost of care if we get people to use cheaper elements of care before they're driven to the more costly elements.
I think that is the point, is using cheaper elements of care. It's very expensive to see me for full mouth reconstruction. It is. People are spending $20,000, $30,000, $50,000 with me. Well, listen, sometimes that can be avoided. Not all the time, but most times it can. if we adopt a lifestyle of health early, and you and I have talked about this on the air a lot, if we start looking at what we can do non-medically to make ourselves better, and listen, the orientation we have is, hey, I'll run a test and I'll take this pill. If that's your orientation, that's a medical orientation. If we're looking at a health orientation, it is, what can I do to make my body work correctly? And once you do that, then the need for drugs becomes far less. I can't tell you how many times each week I see patients who have said, all right, well, I have to eat this amount of sugar. Just a simple thing, sugar. And I know you've heard a lot about sugar from dentists, for God's sake. I'm not saying anything new to you. But people who say, I need to eat sugar, well, everything has sugar in it, and I eat things out of cans and boxes, and all of that has sugar in it, and how much damage that does to the teeth. You know, one of the few things that we get to enjoy as we become older and older and older is eating. You know, the tennis game goes, the golf game goes, a lot of the things that we used to do for socialization goes, but eating never goes. If you don't take care of your teeth early, and I'm not talking about brushing and flossing, I guess I am to some degree, but if we don't take care of ourselves nutritionally, if we don't eat the right things, if we don't stay away from sugar, then unfortunately there's a lot of dental bills that occur. If we don't get a proper periodontal diagnosis early, so that we treat periodontal disease early so it doesn't result in teeth getting loose and teeth as a result becoming lost, if we don't get that taken care of, and by the way, if we don't get that taken care of by a periodontist, yes, by a periodontist, because periodontists are equipped to be able to diagnose early and treat early, and frankly can treat very non-invasively to get this periodontal disease under control. If we do those things, then we can keep our teeth in health, have a minimum investment at the beginning, and maintain later on, rather than trying to go through this major overhaul, major fix, extract teeth, put dental implants in. That's a major fix, and yes, I do that for a living. And I suppose I'd have to find something else to do for a living if people didn't take care of them, if they took care of themselves better than they do. But frankly, those are the things you can do. Eat better. Make sure you're looking at sugar. Understand that we're eating over 200 pounds of sugar per year now. 2 generations ago, it was 40 pounds of sugar per year. So, I mean, big changes. And just if you have gum disease, get that taken care of early.
Let's go back to something you just hit on there. You're talking about if people took such good care of their teeth and their body, they would drive you out of business.
Yeah.
I have a feeling that you, Dr. Lee Sheldon, would find another business that would be just as good to you and kind to you as your dental practice has been. But having put on
You're absolutely right. I'll give you an example. For example, I stopped doing periodontal surgery for the most part over a dozen years ago. My periodontal business hasn't gone down. It's gone up. All right, gum surgery is expensive. We found non-surgical ways in order to be able to treat people just as well at half the price.
Well, that's the point.
So all I need is twice the number of patients, and I do, and we're fine.
Yeah, but what I wanted you to reflect on just a minute with our listening audience was, how do you feel when you realize that the work you've done to help us put helping seniors on the roadmap, and now the efforts you're working with, and I want you to talk a little bit about that, because I think people need to know that everything just doesn't exist ipso facto, done deal. You got to work at making good things happen. You helped us start helping seniors, and you realize at the same time that while you continue to help us do our work, there's some other things you needed to do, and you needed to get the periodontist united the same type way that we're trying to put people together to promote the many wonderful senior programs. In other words, if you have good periodontists in Brevard County, but if people don't know what they can do, what they should do, and how they can help you take better care of your mouth, then their services are lost.
Right.
So what are you doing now to try to promote the overall use and benefits of the use of periodontists worldwide?
Well, we have an organization called the American Association of Independent Periodontists. And the reason we formed that organization is because people aren't going to periodontists early enough. people are relying upon a referral from a general dentist, which may or may not occur. Periodontics is a science. It's a specialty. It's something that's studied, and people go to school after dental school for 3 years to become periodontists. And it doesn't mean that we go to school to become periodontists just because we have to develop a skill set of surgery. Really, what we've developed is a skill set of diagnosis and treatment planning. And if people aren't referred, then they don't have the chance of taking advantage of that. And frankly, if they don't have the chance of taking advantage of a periodontist, they're losing an opportunity to save an awful lot of money on dental care if they're diagnosed and treated appropriately and treated early. So when we realize that the referral model has gradually gone away, now it hasn't gone away entirely, but it has gone away for a whole lot of reasons that we don't necessarily need to discuss here, then I felt it was my obligation. First of all, I was able to discover and create a model where patients would see us first rather than being referred by the general dentist, and it took us years to develop that model. Once we developed that model, and we were one of the few practices in the country to have done that, then I felt it was our obligation to teach other periodontists how to do the same thing. And so last night, we had our second teleseminar of this month, talking about certain aspects of developing a primary care periodontal practice, and we had members on from all over the country participating in that teleseminar.
They were at the seminar?
Yeah.
Here?
It was a phone seminar. A teleseminar.
Oh, okay.
It was phone, so they could call in, and we were giving that seminar by phone. We do that twice a month.
Let me ask a question.
Yeah.
If, you have taped numerous television shows with me, and we've talked about the jaw, we've talked about sleep apnea, we've talked about periodontal care, we've talked about dental implants, we've talked about how a simple two-tooth implant could help lock down a bridge that where there was enough bone to keep the bridge properly in place with the glue they put in their mouth. But with the new work that you've done, have you got enough stuff assembled yet that we could do a 26.5-minute DVD that would show our viewers what it is you're trying to do with this new program?
I guess we do. I don't know if the viewers would want to see that. Because,
why not?
Well, essentially, I'm recreating a business model, and so I'm recreating a business model for perio. Periodontists are used to getting referrals, and now I'm saying, listen, periodontists, you ought to go direct to the public. I think if I were to create something for the public, it wouldn't be necessarily to show them how we're recreating the business model. I don't mind doing that. But I think it would be. I think it would be better put for patients to understand why they should be seeing a periodontist first, particularly if they have complex dental needs or if they have periodontal disease. I could see that doing that in a 26-minute program, and I think that would be very beneficial. Could
you do that in 17 days? I'm asking you a question.
Wait, what's today's date? Today's the 19th.
The taping day is 30. It's the last Friday this month. It's 30 July. Can you be ready to go with the show by 30 July?
I'm going to be just recovering from my oldest son Daniel's wedding, which is on July 25th in Portland, Oregon, and then we're going to be going on a cruise for a week. So
you're not going to be here?
No, I won't be here.
Can you do the taping then on the last Friday of August?
I'd have to look at. Are you trying to make me commit to
something
something
you to commit
on the air?
I'm trying
when
to
I don't even have a calendar to look at.
No, I want you to commit to doing the show as soon as you can, because Lee, the older I get, I see that there are things that we need to think more about doing quicker and doing them so that people can understand what it is and why it is that we're talking about the things we do talk about.
Yeah.
How
about next Friday?
We're not taping next Friday.
Darn it.
I won't say I'm not. I'll talk to Carrie.
Okay.
We'll get back on that.
Okay.
But let's talk about what I want.
By the way,
what's that?
You and I have been together for a long time on the air. You know I don't have any trouble preparing a 26-minute TV show or radio show at a moment's notice. I've been doing this for a while.
I know that. But I wanted to make sure that whatever you use is a model that the tooth didn't fall out.
Good idea.
Folks, we were doing a TV show down it was about a year and a half ago.
And I wanted to redo that taping.
They were showing you squeezing a jaw to show how TMJ, which is the thing in the jaw, it causes stress and tension and headaches and migraines. He was squeezing the tooth model to show what happened, and turned it over, and one of the teeth fell out. And he wanted to redo that segment of the show, and the TV guy said, "No, we're not going to do that, Dr. Sheldon." He said, "That's what's realistic. That kind of thing happens." So, actually, we've had some comments from people that saw the show and commented on the tooth falling out. So it's nice to know that, we're all human.
Yeah.
And we make things, we do things, but what's importantly is that we have people that are very interested in promoting the work of nonprofit organizations so that more people can be helped. And I think that's extremely important.
Well, it is. In fact, you want to get to something that we're doing. You brought it up because we have had Helping Seniors of Brevard County as part of our charitable giving campaign. And we have 8 charities in our charitable giving campaign, anywhere from kids to adults. And if you come into our office for an examination and you want to donate $50, you get everything in that charitable giving campaign. You get the CAT scan, the X-rays, you get everything. Just say you heard me on WMEL, and you'd get
okay,
that.
Wait a minute. Go ahead.
But
you're talking too fast. Talk slow. If somebody comes into your office and makes a $50 donation, and you donate that $50 to the charity they designate.
That's right. And by the way, if you're listening to WMEL, the only charity that we will take it for is Helping Seniors of Brevard County. So you donate to $50 to Helping Seniors of Brevard County. You get full mouth X-rays, CT scan, full examination.
And all you got to do is come in your office and do that.
That's right.
What would a package like that actually really cost somebody?
CT scan is well over $450.
So it's a great thing. And this is the type of thing that we're talking about, driving down the cost of care. We always talk about driving down the cost of medical care. We can drive down the cost of dental care, which also poor dental care contributes to poor medical care.
Of course, we have a greater correlation now than we ever have had before between periodontal disease and a number of systemic diseases. Each time you study a disease, you study asthma, you study kidney disease, you study diabetes, you cover Alzheimer's disease. There's a correlation between periodontal disease and each one of those. And the more diseases that are studied, the more we find out that if periodontal condition is out of control, you have a better chance of having one of these other systemic diseases.
Okay. I'm going to ask you the first question I had out of 10 I was going to ask you today. The first question is this. We got 7 minutes before the break.
Okay.
What's the importance of good dental care to seniors?
Good dental care means a lot of things to a lot of people. And I think the first level of dental care is getting your teeth cleaned. Just get your teeth cleaned. You can't believe the number of times that periodontal disease, and it's been studied, by the way, that periodontal disease can be held in check just by getting your teeth cleaned on a regular basis. The other thing is this: by having frequent dental care, if a cavity occurs, you can catch that cavity early. And if you catch that cavity early, it's more likely to become a filling rather than become a crown. All right? A crown costs around $1,200, $1,300. A filling costs anywhere between $100 and $200, something like that. If it's larger, it's going to cost more. But that's a tremendous difference in dental care when you're spending $1,300 for a crown versus paying $200 or $300 for a big filling. So there's a way of driving down the cost of dental care.
The ironic part about it is that we can talk about implants costing a lot more.
Yeah.
But the truth of the matter is that there's always going to be a need for dental implants and more expensive dental care, just like heart surgery, aortic surgery, valve replacement. There are higher costs in different aspects of medicine, and the cost is dependent on what the procedure is and how important it is.
Yeah.
I can't imagine what it would be like to not eat an ear of corn. I just can't imagine if I just couldn't do that anymore because I couldn't keep my teeth in to do it, or I didn't have the teeth to do it, or I didn't have the bone structure to do that. So a lot of times we just take so much for granted. We have good health. We have a great medical system in the United States. We don't appreciate what we have. And we can talk, like I know the excessive use of sugar is detrimental to our overall health care. But think how many of us violate that every day. Even dentists will go in and eat hard candy and break teeth.
Yes,
won't
yes,
they?
Won't they? Dentists will do that. The generic dentists will do that.
I'm speaking to one.
You're speaking to one of the generic dentists who did that twice.
We all make mistakes, Lee.
Yeah, but you're supposed to learn from the first one and not do it the second time.
But
shows you how smart I am.
But think about the capabilities we have in our country to fix whatever those problems are.
Yeah, and I think, if you're trying to reduce the cost of healthcare, then you would rather prevent than fix. That's in any aspect of medicine or dentistry or any place else. It's cheaper to prevent than to fix. But even in the fixes, we have been able to reduce the price, for example, of full-mouth dental implants. We've been able to cut that down quite a bit. So, the fixes have gotten better as well as we become more efficient in delivering systems or treatment.
I'm not going to ask this next question. We're too close to the break. When we come back after the break, I want to get Dr. Sheldon's perception on advancements in senior dental care.
Yeah, we'll do that.
With that thought, let's take our quick break and stay with us, folks. We got some other stuff, and I'll let you know the rest of our sponsors. Stay with us.
AM 1300 WMEL.
This is Joe Steck. We're back live with the second half of the show. I want to remind everybody that the purpose of helping seniors is to inform, educate, and connect seniors with resources, and you do that by calling Kay at the office at 473-7770. And if you just are even thinking or wondering about the type of care that you're getting, or if you're making a call to the Elder Helpline, or you're calling some of the local nonprofits that are funded by the state and federal government, and you don't get an answer, and you've called several days and you don't get an answer, please call Kay and let us know. We cannot do anything about helping get information to the right people that can make the services go to the people that they're supposed to go to unless we know the people aren't getting served. So that's extremely important, folks. The number again, 473-7770. And the reason I keep harping on this, folks, is that you'd be surprised. Those of you that read Hometown News, Senior Scene Magazine, Spotlight, and Ebony News, you read my columns in there. I'm pretty brutal, pretty frank. I say exactly what it is. And just for your information, if I'm saying something that has to do with the practice of law, I run my columns by an attorney first so that I know that whatever I'm saying is legally sound. So I'm not going to get caught in that trap. But I can tell you that after people read my columns, they are starting to make more inquisitive calls saying, why does Joe say this when this is what's happening? Or why does he think that should happen when it doesn't? And Kay will say to him, that's why we ask you to call. We need to know what is not coming your way that should be coming your way. So, it's just like elder abuse. I had Laura Moody on the radio show last week. And by the way, folks, Laura did a great show last Thursday here on WMEL. And if you want to listen to what Laura and I talked about on elder abuse, you can go to our website, helpingseniorsofbrevard.org, and you can pull a radio show up there and listen to it. Laura gave some great suggestions and recommendations, and one of the primary things she said was, elder abuse is one of the most underreported crimes in our country. And you report elder abuse by calling 1-800-963-5337. Or you can call the Elder Helpline. But I recommend calling elder abuse. And if you don't get an answer, call Kay. We've had several people who did that. They called Kay. Kay called me. I made a call to Tallahassee. And I tell you, it took one day, but an investigator got on it, and they took a look at it. There's just nothing like getting the right people to look at what should be happening that's not happening. So I'm not saying agitate. I'm not saying stir up trouble. I'm saying try to get people to do the right thing that we're funding them for through our tax dollars. So that's extremely important. The sponsors for the second part of the show include Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney of the Braswell Financial Team, Kenneth Chiropractic, Canadian Meds of Melbourne. By the way, Joe Pons down there is doing a great job, so you might want to give them a call if you've got medication problems or questions. Wiedemann Malik, and they're doing a great job. Vitas Hospice, and the last one is Brooke Goldfarb. Brooke Daratani was her, I knew her as Brooke Daratani. I knew her mom and dad, Tim and Andrea Daratani, when we used to work together down at Florida Tech many years ago. But she's a Harvard Law School graduate, and she has a business called Peaceful Beach Mediation, not meditation, but mediation. Brooke is trying to convince seniors to try to talk your problems through before you get into a divorce court. And the main thing about seniors, that makes a lot of sense, doesn't it, Lee?
Sure does.
Makes a
lot cheaper.
A lot. Oh,
and Brooke's a nice person. She's going to help you.
Well,
I know Brooke too.
You know Brooke?
Sure.
Yeah. Well, it's just like, doing shows with you, with your contacts, with your charitable organization. We all work together, and by it's information. What you're able to tell people on the radio and the TV shows about their mouth, getting teeth fixed, the simple things such as flossing. And Billy, every time I pick out that darn dental floss package up, I always think about you when I'm flossing my darn teeth. And I got a special toothbrush that I got one tooth that's got a gap between her. I like to take that the longer bristle and wiggle through that hole in that tooth to make sure I get it good and clean.
Feels so good, doesn't it?
But if you have fun, if you can have fun talking about something that's important to people, don't you think people can understand it better?
Well, we talk a lot about that in our office, and I'm talking a lot about it with my national organization as well. As a matter of fact, we covered it big time because, I follow the Hubbard management philosophy, and one of the things is not necessarily the mechanics of what you do, but it is the tone level in which you can carry it out. If a person is enthusiastic, and that's a high tone level, then you're going to be able to get more done, you're going to communicate better than somebody who is apathetic, which is a very low tone level. And so, yeah, we've got to have fun in what we're doing. And I think those of you who've come into my office, and Joe, you've been in my office several times.
Yeah, I see you standing in those pink scrubs with those instruments in your hands waiting for me to sit down in the chair.
Exactly right. With friendly people. With friendly, with the staff that just, and frankly, Danielle is the keeper of the tone level. If she sees my tone level going down, do you know that Danielle takes me out for a walk to lecture me and make sure that my tone level is back up before I walk in the door? And if she's doing that with me, her boss, imagine what she's doing with the rest of the staff. And so the key is to make the dental office, which I can't understand it, but it may not be the most pleasant place to be.
Right,
but if you keep the tone up, it can be a lot better, and things go a lot faster, and you enjoy yourself while you're there.
You guys are the greatest inflictors of pain. But having said that, you happen to give, and I've been to a lot of dentists in my life, Lee. I don't believe there's a dentist alive that gives a better, more effective medication and numbing shot than you do.
Thank you.
And, I think there's an art to sticking a needle in somebody's mouth and not hurting them.
Yeah. And I've got two guys who work with me. You've met, of course, my son Matthew, and who's our general dentist in our office, and of course our new associate who's been on the air with you a couple of times, Dr. Michelle Furtado, and they all learned how to give that injection. As a matter of fact, they let me teach them how to give that injection, and they do it as well as I do.
Yeah, it's an interesting thing when you talk about simple things like dentistry, and dentistry can be very simple, but it can be very complicated too.
Well, the complexity has to do with the amount of disease that's present and what you have to do in order to be able to get things back into shape. We saw a patient yesterday who wasn't a senior. She's in her 40s, and she had let things go, and but she was also born with abnormal jaw size. Her upper jaw was much bigger than her lower jaw, and therefore her teeth didn't come together very well at all. And that was part of the problem that she was having, is that her teeth didn't come together very well, so there were very few teeth that were meeting. And if that's the case, those few teeth are taking an awful lot of stress. And so we saw her yesterday. We actually gave her a graft. We actually inserted a new smile into her mouth. We had her smile.
What do you do in a case like that?
The three doctors this morning met and talked about her for 45 minutes in order to come up with a treatment plan that would work well for her. And yes, there is a treatment plan that can work well for her.
What do you do?
Essentially, what you have to do is, we always work from the aesthetics down. I want to make sure that the smile is right first.
Okay.
But then once you've done that, you actually can crown teeth. And places where you can't crown teeth, you can do dental implants. Or you can do orthodontic therapy in order to get teeth lined up correctly so the bite is correct again. So it's a matter of, do we move the teeth or do we crown the teeth in order to be able to restore the bite relationship? And we came up with a treatment plan using a method of using just crowns. Just crowns.
Do you do crowns then?
Oh, my son does. Yeah, Matthew does. And so it's great. I love, in fact, I said this morning after we got done with our case conference, which we do every Thursday morning at 7 a.m., and we talk about patients who have complex problems. And here's three doctors just talking together about what each of us could do in order to be able to help this patient. By the time the 45 minutes was over, we had a treatment plan down that will work.
Do you ever think about what we might be able to do better in the treatment of seniors with regard to getting them to avail themselves of dental care leave?
Oh, all the time. I understand that part of this is an affordability issue, and yes, dental care does cost money here in the United States, but there's certain advantages to being able to pay for services because you can choose what you want and choose what you don't want. And you should be dealing with a dentist who can explain that very well so that you understand in advance that if you spend a certain amount of dollars, you're going to get a certain result. That's what I'm teaching with the AIP. That's why I'm recommending that people see periodontists first when they have complex problems. But too often, seniors don't avail themselves of dental care not because of the cost, because they don't know what the cost is. They haven't come to the dentist, but because of fear. And I think part of the fear has to do with some childhood experiences that they just keep on reliving and reliving and reliving. Part of it has to do with they don't know that we can do things comfortably, whether we do it with a good injection, the way you were talking about, or whether we do it with anesthesia. We can do it, and we can do that in the dental office and keep people comfortable and help people keep their teeth. It's always less expensive, by the way.
Yeah,
to keep your teeth, if you can, and if you can do that predictably.
One of the things that we're getting a message here. What's he saying?
Yeah, essentially, what we want to do is understand that in our office, if you're listening to this program right now, and you are, or if you're listening to this program on helpingseniorsofbrevard.org, if you call our office and tell us that, and say, I want to participate in Dr. Sheldon's charitable giving campaign, here's what you will get. A full examination, full mouth series of x-rays, CAT scan if needed. And all you have to do is write a check for $50 to Helping Seniors of Brevard County.
And you can deduct that.
I won't be the tax guy. I'll only be the dentist.
No, seriously. Well, they can deduct that as a charitable donation.
It is a charitable donation. You have to talk to your tax advisor as to whether it's true or not, because they are getting something of value for that donation.
Vince was trying to send us that message with my glasses. I couldn't read it on the screen. I had to get Lee. That's why I took the break. But I'm glad I asked Lee to look at it because, it's interesting because people it's a good deal. It's a good deal for the patients, a good deal for our organization, and
I'm very proud of this.
Yeah.
We've collected over $150,000 in charitable contributions, and it isn't unusual for a person to say, "Look what I got! I think I'll write a check for more than $50." And of course, that's all going to the charity. You just write the check. We mail it into the charity, and
I know
happy.
because I get the letters from you. Elmer usually, her wife usually has his name, and she sends it over.
Yeah,
but one of the things that we were talking about senior care. Seniors are afraid of having a dentist look at their mouth and saying, my teeth don't look good, they hurt, and it's something that's going to cause me more pain. But if the truth be known, it's probably, if they go to the dentist and have them take a look at what they suspect is the problem, they're probably going to get a fix for much less than they thought it was going to cost, and prevent them from having more sickness.
Yeah, I can't tell you how many times it's magnified in somebody's mind. I'll tell you what happened just this week. I was seeing a patient who is, I believe, in his late 50s, early 60s. And he had an upper denture, and had an upper denture for a number of years, and he was ready to have his lower teeth extracted and have a lower denture made. I did an examination on him, found that we could save every tooth on the lower arch for less than it would cost to extract the teeth and put in a denture. So, yes, it's diagnosis first. He's going to be able to keep his teeth, not have to wear a denture in the lower arch. And a denture in the lower arch is extremely uncomfortable. So here we're going to be able to save all of his teeth predictably for a long period of time.
Okay. In the time that we have left on the show, I want to talk just a little bit. Let's get off the subject of dental care, but as a dentist and with all the seminars and things that you go to and that you have attended, I noticed you got some really, you mentioned the business of overuse of sugar.
Yep.
But I would really like for you to talk a little bit about the effects of obesity on lowering good medical care, and how to some advice from you about how we make people aware of the dangers of overeating, obesity, and the consumption of salt, sugar, and some of the other things we do. It's a loaded question. It's a lot. How does Dr. Sheldon answer that?
The McDonald's syndrome. What's the McDonald's syndrome? I'll stop in a fast food place and stuff something down my face. If we go to our favorite food store, and if we look in the center of that food store, we'll find all of the processed food. All of that food where the machine has eaten the food first and you're eating the rest of it. If you go around the outside of the store, you'll find all the fresh food. What's interesting, if you eat just the fresh food, and I don't care, meat, poultry, fish, vegetables, if you eat that food, you'll stop because you've gotten the nutrients you need and you won't eat any more. Essentially, your self-regulating mechanism will stop you from eating any more than you need or that you want. But if you go in the processed food section, where there are no nutrients or very few nutrients in that food, you're going to be stimulated to eat more and more and more and more and more. And that's where obesity comes from. Now, are there other things that can cause obesity? Are there metabolic problems that can cause obesity? Of course there are. And I'm not a physician, but a physician would tell you that yes, that occurs. But it occurs in a very, very, very rare circumstance. The basics,
very few people.
Yeah, it is. The basics for us are going back to eating really fresh foods and preparing fresh foods, learning how to prepare them simply. I was just at Publix last week. And you know how they cook at Publix. They cook samples. They have recipes there, and they have the food right there, and it's very simple to prepare those foods. And frankly, those are the kinds of foods where if you eat them, these are fresh foods. If you cook them and you eat them, and you can get all this cooking done in less than a half an hour, you're going to have something that tastes good, and frankly, you're going to lose weight.
Lee, my wife is a very good cook, and we look forward to what we call all vegetable dinners.
Yeah.
To me, And when I say vegetable dinners, when Terry buys if she brings home really good corn on the cob from the store, I say, why did you just get 2 ears? Why don't you get 4? Because we always eat the other 2.
Yeah.
I love corn on the cob. But I always ask her, did you get a loaf of the Italian whole wheat bread? Of course, bread, too much of it's not good for you either. That creates a lot of sugar. But does it help if you toast it?
No.
It doesn't.
Sorry.
I guess. But it still tastes good with a lot of butter.
That's the anti-health food talk that I was just giving.
I know.
And whole wheat doesn't make any difference.
You can live to eat, or you can eat to live.
Yeah, well, I live to eat, frankly. I really enjoy food. I live to eat.
I enjoy. We eat a lot of stir fry.
Yeah.
And we think that one of the best ways to fix chicken is just with lemon pepper sprinkled on it and cooked on top of the stove.
Yeah.
And,
and it's simple.
It's simple.
You cut it up. It doesn't take long to cook at all.
And there's no fat, no grease.
Nah,
you got that with there's so many fresh vegetables available in the markets now, and
particularly now.
Yeah, I like soups. Of course, I give a plug for Panera's for their broccoli cheese soup, and that's probably, of course. And I put a couple of big hunks of bread in it. I love that, but you have to live your life.
Well, I'll tell you, I went to Publix last week on Sunday, and they happened to have a fresh turkey. I don't know why. For July 4th, they had a fresh turkey. But there was one fresh turkey at the particular Publix I went to. I picked it up. I cooked the turkey. Yeah, it took about 3 hours to roast the turkey, and I had food for the entire week, including once I took all the turkey off the bone, I put the bones in water along with onions and celery and carrots and spices, and I made soup. So
I know.
Now I have turkey salad and I have turkey croquettes, and it was one cooking episode of 3 hours.
There was a time several years ago that my wife was teaching a class at church, and I figured I had her gone from the house for 4 or 5 hours. So I slipped over to the commissary and I picked up a huge ham. And I brought that ham home, and we've got one of these cook pots that's made out of aluminum. You have to fit it on 2 burners on the stove to get it to work. Mm. And I put that ham in there. I started cooking that ham. Of course, I haven't finished boiling it down by the time she got home. Of course, the damage is already done. And I think Terry split that thing into 4 big sections. But it makes the best lentil bean soup, and I think soup is one of the best things known to mankind, especially homemade soup.
Yeah,
there's a difference. But this is all related to dentistry, because the type of food that you put in the mouth depends. It affects the porcelain on the teeth, doesn't it?
Yeah, it's so much easier to take the frozen dinner and just cook it, or at least it seems easier. If you look at the amount of time they actually have to put that in, and then you put it in the microwave, and the microwave is not doing good things to that food. If you just take the fresh food and just try it. Just try a little bit of it. Take the fresh fruit, fresh vegetable. Just go to the Publix place and just follow the recipe. It's really simple, and you're really going to enjoy yourself. Okay. And you're going to lose weight. And your dental care is going to be a lot. You'll have fewer dental bills with me or anybody.
You didn't come to the show in time to see Rocky sitting on my lap out there. Does Eleanor still have all her cats?
Almost.
Almost?
Yeah, almost. She's got about 14 now.
Oh, my God.
Down from 30.
Okay. Folks, we're out of time. I want to thank Dr. Sheldon for being on the show. It's always a pleasure to have him here. And we're going to get back swing. He'll be back on his regular schedule once a month on the show.
Yeah, I'll be back here. Yes.
All right. And thank you, listener, for listening. We'll see you next week. Bye-bye.